Hello, welcome back. The topic today is bitter taste in the mouth or sour taste in the mouth. So that is the topic today. So most of the people come and say the early morning when I wake up, I have a very bitter taste, a sour taste in my mouth, excessive salivation, or sometimes with a bitter taste when I brush my teeth. I feel like vomiting. These are the signs they come and ask what to do. So first and foremost, it could be a normal phenomenon. It could be a normal one. But if it affects throughout the day and it affects your food intake and if it affects your daily life activities, then it becomes a serious problem. So how could it be a normal one? Suppose you eat some oily food. Suppose you have a some different food and you have a heavy meal. So that time you burp suddenly and the acid, food, bile, everything comes up and you can have a bitter taste. And usually it linger for some time and it can go off on its own. But if it affects every day and it affects your food intake, then it becomes significant. So what are the things can happen? First and foremost is oral hygiene. So anything in the oral part. First and foremost is hydration. Suppose your water intake is very low and you are dehydrated, your mouth is dry, so that can cause dryness can cause sour taste or bitter taste. Number one. Number two, any infection, the gums, the tongue, or even your teeth, then that can cause. And nutrition deficiencies, certain vitamins deficiencies, especially vitamin B12, iron deficiency. The tongue becomes kind of ironed out, it inflamed, then it can cause these things. And in children, the first and foremost could be probably they have a tonsil infection. The tonsil infection produces a pus, then can cause some sour taste. In adult, post-nasal dribbling. Suppose an adult has a sinus problem and they are sleeping with the head like this. The fluid, infected fluid, dribbles back into the mouth. That can cause a bitter taste. Alcohol, smoking. These are very important, and of course, very heavy, oily food that can cause. And suppose they are obese, it can cause acid reflux. Apart from the oral hygiene, the next is gastropart. Gastropart, GRD, acid reflux, or ulcer, or obesity causing hiatus hernia, acid reflux. These are things can happen. That is why we always say, suppose you have it's all because of your stomach problem. Stop taking food after 7 p.m. Have a very very light, meal in the night, preferably steam cooked food, or reduce your weight. Your central obesity can push, and the acid and all your stomach secretions can come up, especially when lying flat. So these are the next is anything in the chest infection. Chest infection can cause bad breath as well as the bitter taste, sour taste. The next is suppose somebody is pregnant. Yeah, especially the first trimester, first 3 months of pregnancy, literally pregnancy per se can cause, or even acid reflux, or the medicines they are taking, especially iron, that can cause a bitter taste. So this is very important. And people on chemotherapy, invariably they will have a bitter taste. Of course, this is all because of the medication, and other medications can also can cause, especially antibiotics and painkiller. You take it for more than a week, then that can damage. They can cause acid reflux. The bile secretion changes, so that can cause a bitter taste. The the next reason is any problem in the liver. So liver is the one which excretes your ammonia, the byproduct of the digestion, converting into the urea. Suppose you have a liver problem, this ammonia is not converted to urea, so that can cause, or even sometimes jaundice can cause the kind of bitter taste, bile secretions. Suppose you have a gallbladder stone, the gallbladder infection, or can cause acid reflux, that can cause a bitter taste. And obesity as such can cause acid reflux. These are things. And apart from that, late night food, late night fatty meal, alcohol, smoking, all these things can cause a bitter taste or the sour taste in the stomach. Literally or simply, we can say most of the time it's something to do with your oral part, like dehydration. That is the first and foremost. Infection, the gum, tongue, maybe teeth. Children, tonsil. Adult, postnasal dribbling because of the sinus problem, or even vitamin deficiency. And the next is, most of the time it's from the stomach part, ulcer, acidity, acid reflux, hiatus hernia, gallbladder diseases that can cause. So the doctor will examine you, ask you some history, and he can run some tests, especially endoscopy, ultrasound abdomen, or some medical issues, want to some blood tests, nutrition deficiencies. All these things once they're ruled out, and if the medicine is the root cause, if they know the cause, they will change. If medicine is the root cause, probably that particular medicine can be stopped, especially if someone is taking supplements for prolonged. Some people are taking multivitamins thinking that it's very good for health. No, these multivitamins can cause sour taste. It can cause, especially suppose they are taking chromium and zinc, that can cause bitter taste. Zinc deficiency can cause, but taking too much of zinc and chromium can cause. And suppose they're taking iron supplements, iron can cause acid reflux, acidity, constipation, and sour taste. So these are the other reasons. So once the doctor says, okay, certain medications, if you can't stop the medication, so he will say change the timing, or maybe from the night to the morning, morning to the night, or after food, or try some combinations. And if you have a sour taste, each time after the food, you can brush your teeth, you can take steam cooked food. And these are the small non-medical managements. If they fail, sometimes the doctor may give you a proton pump inhibitors or the antacids. Usually they're given for the acid reflux and the acidity problem. So lifestyle change, looking for the root cause and treating the root cause. So that is for the sour taste or the bitter taste in the mouth. Thank you.